Hi everyone. Good morning, good afternoon, and good evening, depending on the country you're coming from or residing at the moment. By the grace of God, today we shall be discussing about management of dysmenorrhea, that is painful period, as we all know. A few weeks ago, I made a post about the causes and possible types of dysmenorrhea. But then before we go into the management properly, I would just like to give us a recap about the management of about the types and causes of dysmenorrhea. Please ignore what you're saying over here. Just a reaction to common cold. Yes, nurses get sick too. We fall sick too. Yes. Um, what is dysmenorrhea? What is menstruation generally? Menstruation is just a healthy or a normal part of a woman's life where there is a normal or physiological changes at intervals, usually average of 28 days, where unfertilized egg, the lining of the endometrium, and some products like blood, tissue are shed off from the uterus when fertilization doesn't occur. Usually, the woman ovary secretes or releases an ovum every month. Yeah, if this left ovum is releasing this month, next month the other ovum releases it also. So when fertilization doesn't take place, those things break down and there are hormonal changes as well that occurs. So they are now being removed from the body as what? As menstruation. Now it is supposed to be a normal thing. Sometimes even unnoticed, what you just see is the blood and its products coming out. But where the contraction of the uterus is exaggerated beyond normal, it is known as dysmenorrhea. That is painful menstruation. It actually happens when the normal physiologic responses is extreme. You understand? Now, what are the types or what are the causes? Yeah, the types actually depend determine the causes. It is generally classified into primary and secondary dysmenorrhea. Now, primary dysmenorrhea is a kind of painful menstruation, which is not associated by any cause, underlying cause. It doesn't have any disease condition uh, causing it. It it happens due to the fact that there is overproduction of what we call production of what we call prostaglandin. Prostaglandin is like how do I explain it? Okay, some books have referred to it as academic books have referred to it as lipids, while some have described it as a hormone-like substances. Now they are produced by the body and they help to regulate a lot of um, bodily functions, including inflammation, uterine contraction, induction of labor, ovulation, menstruation, things like that. So when it is overproduced, now the normal physiology of the uterine contraction during menstruation is defeated. Instead, it is extreme. It's like a pump of water. Eh? When steady, when normal, through a tube, it flows steadily. But when you apply pressure at the mouth, you find out that there is this sharp and projectile motion of water, right? So this is what happens when there's overproduction of prostaglandin. The uterine contraction tend to increase, and that is when pain comes in. It's like I have a wound in the uterus on my hand, and you are pressing it again. Shebi pain will dey now. Pain go dey. So this is actually what happens in primary dysmenorrhea. Unlike secondary dysmenorrhea, where there are underlying causes like endometriosis, we have things like fibroid, we have things like PID, things like that. These are some of the underlying causes that causes dysmenorrhea, and it's usually common in older ages. Now, I also forgot to inform us that primary dysmenorrhea sometimes goes off when we give birth. Sometimes it goes off when we give birth. Some books have said it is because there are overstretching of some nerves pathways. So the overstretching of it can reduce the pain thereafter. And some have said after delivery there are hormonal changes with decrease or decline in that prostaglandin uh, levels. And some have said the changes that occurs in the uterus can also lead to decreased menstrual pains. That's why some women after delivery, that pain, that after childbirth, that dysmenorrhea, that painful, what do you call it? Painful menstruation goes off. I hope we're clear, right? Okay. Now let's go into management properly. Now, what do you do if you suffer from one of these things? Now, one of it is pain reliefs. We have pain relievers, over the counter pain reliefs, like paracetamol, pyroxicam, ibuprofen, diclofenac. I have seen women who go for medications like pentazocine, tramadol. No, 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 please. Those drugs are addictive in nature. It is not advisable you go for such drugs. We have over the counter drugs like paracetamol. Ibuprofen, diclofenac. However, I will advise that you don't take much of NSAID, non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac. Prolonged use of them can cause GIT, gastrointestinal tract bleeding, gastrointestinal tract bleeding. It can or corrosion. It can cause irritation or bleeding off. So it is not advisable you take them often. And sometimes when we take them too often in high doses, they can actually decrease the secretion of prostaglandin. Eh? They can decrease the production of prostaglandin to a lower level. That contractility, that ability to contract, the ability of the uterus to contract is defeated. So you won't have much to push out. You end up just having a menstrual pain for just 1 day, or your menstruation for just 1 day or 2 days, and it goes off. The remnants stick in and become toxic. You now start having fever, headache. You are the cause. So we shouldn't take these drugs in overdose. Please talk to any healthcare provider around you, or you go to the nearest hospital and have the appropriate dosage. Are we together? I hope we're following. So we should try and avoid some of these things. And prolonged use of it can also cause this PUD, peptic ulcer disease, any form of these ulcers, right? There is a link between uh, the this NSAID and the production of prostaglandin. It inhibits the synthesis of prostaglandin when we take them. Are we together? Then another thing again is dietary modification. Diet modification. Now, I am very sure that you've had some people saying, don't take sugar when you're menstruating or when you're close to menstruating. Yes, it is true. Hmm? There are group of foods we call inflammatory foods. They're like deep fried foods, alcohol, sugary foods or drinks, processed meat. All of this falls under what we call inflammatory food. So they actually have effects on the production of prostaglandin. So when you eat them, there is increased production of prostaglandin that actually exaggerates the contractility of your uterus, causing pains during what? During menstruation. So they can actually what? Intensify the pains you feel during normal or physiologic menstruation, and you now start shouting, hey, Jikina, eh? I will hear mothers telling their daughter, don't take cocoa, don't take Fanta. This is the reason actually. Then another management is hormonal therapy. In cases where hormones are secreted high or low, it should be corrected. This will be done through the help of some investigations. Hormonal assay to know which of the hormone is low or high. From there, the healthcare provider will know when to actually come in. Then exercises. Exercises. What do you do before during menstrual dysmenorrhea? Now, exercise have proven to be good in management of menstruation, dysmenorrhea, sorry. Exercises like pelvic exercises, walking, yoga, meditations, and a lot of them you can think. Breathing exercise. Yes, these are some of the exercises that have proven to what to lessen the pain we get during menstrual painful menstruation. Last but not the least is what we call heat therapy. Heat therapy. I have assisted in this therapy because I've done it for some group of people. Yes, and I will still do it when I come across any, right? It is very, very effective. Now, heat therapy, what does it mean? It means using heat, using heat or something warm to treat something. Hmm? Are we together? So a warm bath, a warm drink are part of heat therapy. However, there is this uh, method I use then, and I don't menstruate, though, but I use it for people who are very close to me then. And you boil hot water. You boil hot water. Once it is boiled, use a PET rubber or this plastic rubber.